What is it that Starling Physicians is doing to relieve the hospitals during this time?
A number of things. We are certainly open. We're open in a number of different ways, and we're trying to be thoughtful about that. So we are keeping patients home as much as possible, and very quickly ramped up telehealth, and are doing a lot of visits that way. That said, we want to help decompress the emergency rooms, and so any patients that do need to be seen urgently, we can see in the offices if they need to be seen in person.
Why did you find it important to put Starling Physicians kind of on the front lines here with helping hospitals and taking away some of their workload?
A lot of us, we already have close relationship with the hospital. Many of us work in the hospitals in the community and are continuing to do so during this. So I think we're acutely aware of how busy they are and how busy they expect to be during the surge. And it's just part of the mission. When people are sick, we need to try and be there for them. Obviously, that's harder under the current circumstances, but we certainly didn't want to close and just not be seeing outpatients during such a critical time for the community.
Have you been working at all with the state and making sure that you have the proper personal protective equipment and supplies that you need, especially now that you guys are opening your doors for testing?
That's been difficult because, as everyone knows, there's a shortage everywhere. We've had some conversations with the state, but we've not actually received any equipment from them. I think they're probably focusing more on the hospitals. We've been able to source our own and are currently okay. But I can tell you it's been with some out of the way sources, not our usual sources. We've, kind of jokingly had to go on eBay and Amazon to find masks as this has been going on, and that's been successful thus far, but it's certainly a concern.
Is there anything else that you'd like to add that you think that the public needs to know?
Just that, obviously take this very seriously. I think Connecticut is. It's concerning that there's other parts of the country that perhaps are not. Also that, for the average person who gets this, it generally is not a severe illness, although of course there is a subset where it is a terribly severe illness. So, people with mild symptoms don't necessarily need to be trying to get to an emergency room, and don't even necessarily need to be tested at this point in time when we don't have great availability of testing for everyone. So if you're doing okay, it's fine to stay home. Certainly call us or call one of the other hotlines around if you need advice, and we can provide that and hopefully keep you home and safe and out of an emergency room. But one way or another, we're here. We can try and answer questions and see people as necessary.
Thank you so much for joining us today, Dr. Posner. I really appreciate it.
Thank you.